the focus groups and information sessions and the data that's been collected over the last few years by the city and housing staff, the question needing an answer now is, what are you going to do with it? What are staff doing with it? And what is being done in response to accommodate our perspective? So with that, I'm looking forward to Joy's report. I think it is extremely valuable, and it was, you could say that in a way that she took a gem in the rough and was able to cut through a lot of issues to come up with a jewel in many ways, out of each of the participants, to come up with a really good set of principles and some good ideas for methods that will be, that need to be refined collectively. So thank you very much for your time today.
Thanks so much. And I think what I'm going to recommend is that I agree with you. I think this is not the end product. This is maybe the beginning of a process. So what I'd like to suggest is actually we hear from Maureen and then actually go dig a little bit more into the report that we received, and then we can maybe go back to some of the points that were made, if that's okay with the group, unless there's anything clarifying. Yeah. Okay. So how about we hear from Maureen then?
Hi, everybody. Thank you for giving me a few minutes of your time. It's so great to see so many people at this meeting today. And it was just a delight to meet most of you at the launch. My comments are kind of an overall comment on 6, 8, and 10. With the lens of looking at, are we reaching our goals? Are we still trying to achieve goals around transparency, collaboration, and accountability? So I'll just touch briefly on the 3 reports, the first being Joy Connolly's report on the tenant engagement system. As Bill stated, there was a lot of work done, and I give a lot of credit to Joy Connolly for everything she's done, and to the fellow STAC working group team members. I don't agree with all of it, but that's for another day. There is one issue, though, that I haven't been able to let go of. To me, the word method, because we're working on principles and methods, method should involve some detail on a framework of how it's done, how the new system would be done. Now, when Joy presented a draft to the city staff, that we had at that time worked on models of a framework, and she was told by city staff not to include them as they were, quote unquote, too prescriptive. According to the motion 38.5 and descriptions throughout all of the report, that it was to be written by STAC with an independent facilitator. So I question, 1, why is city staff altering the direction of the report? And 2, why is city staff not communicating directly with STAC on their involvement and redirection of the report? Even the letter from Jen St. Louis states that the report was produced by Joy and STAC. So I just thought you should know that we all had worked on that framework, but they were not included in the report. Now on to Health Commons. Well, as you'll see, as you've gone through it, there's not much to it. Sonia has worked very hard, and I can only hope that the report to the full board meeting in 2 weeks will include all of the information that she will be synthesizing over the next couple of weeks. This project has been a bit confusing and frustrating to STAC members because it's felt like we've had to pull teeth to get things like timelines and understand where they're at and who's involved. It's been kind of a mysterious thing moving forward. There have been weekly meetings with SSLTC staff, but we've not been privy to the information that's been shared. I started to ask SSLTC staff in May for summaries of what's being shared and some sense of progress. I specifically asked SSLTC for a copy of the original agreement or project description and I was denied. I've raised issues and made comments, and I have no idea whether they'll be in the June 30th report. We've been offered a chance to review it after June 30th, but not before. So it's not actually being presented with any type of stack overview or approval because we don't know what's going to be in it. And on the third is the city involvement. I don't know about you, but if I handed that in as a university or a college report, it'd probably be given back to me. There's nothing to it. In my opinion, there's no detail, there's no substance, and there's no accountability here. But since it was Councillor Fletcher who asked for the report on the city's involvement moving forward, I'll leave any further comments on it to her. But I would certainly like to see something more in depth. And that's it for me. Happy to answer any questions.
Great. I'll just make a comment that it appear that your deputation has covered 3 items. And so we're maybe we just actually focus in on the first one, because I think that your first comments were with regards to the stack report. And then we actually need to consider these comments for the subsequent items that we're going to get to as well. I did see Councillor Fletcher's hand go up though, so I'm happy if we could defer the comments around the ISM until that point, but feel free to jump in, Paula.
Oh, yeah, this is mostly around the tenant engagement because it's really and truly, I agree with you, Chair, they're quite connected because how do the tenants be engaged in the ISM? It's not, nothing
Right.
for us without us. So what's that entry point look like? What's that larger discussion look like? So I just wondered, Maureen, how you see the two things fitting together.
Well, that actually was part of what we discussed when we were talking about framework and the staffing of the ISM and the tenant engagement framework model has to kind of interconnect like a zipper, working all the way up the line and down the line. And we've suggested interactions of roles and descriptions of roles. Yes, they have to go hand in hand because it's going to be the staff. I mean, engagement requires both ends. So it's going to be the staffing that are going to be engaging with the tenant engagement leaders or reps or whatever we call them at each level.
And I guess my next question is, this is kind of the real meat and potatoes of the seniors corporation: tenant engagement, community engagement, and the ISM. So your advice, the chair just said, let's assume this is just the starting point, not the ending point. So often we just receive things for information and go ahead, but these should just be, in your opinion, kind of some anchor documents that we continue to work on and refine and see how they knit together in order to make sure that this corporation lives up to its stated purpose. Would you agree with that, Maureen?
Absolutely. I absolutely agree, yes.
And
it's
just
a starting point.
A starting point. So even in the tenant engagement model, what I have noticed, and I'll ask about, I'll ask staff where that is then, the actual engagement part. So thank you. Yeah.
Thanks, Paul. I agree with you. Thanks, Councillor Fletcher. And I'm in agreement. I think that this is a starting for, some of it is for information. And I think when we get to the report on the health and wellness, I think it's a status report. It's not actually a final report. But the stack, why don't we start with the stack report? If there aren't any other questions, I'm going to put it over to Arlene, because I think that there's some questions that Maureen and Bill raised that I think actually will be questions that we have as well as board members in terms of next steps with regards to this report. And I first do want to thank the members of STAC for a thorough, it's quite obvious with the size of the report and the thoughtfulness that has gone into this, that this was a tremendous amount of work. So I want to start actually 21st with thanking people for their contributions to this beginning. And I actually feel that we're very fortunate as a corporation 13 days in to have such a meaningful document as a beginning piece for that zipper that you talked about, Maureen. So Arlene, do you want to take it from here in terms of just giving us a little bit more, or if there's anybody else that's going to speak to the report?
Yes, thanks, Linda. And actually, I'm going to turn it over to Jen St. Louis from the city as the staff person that was leading the work in the city's portfolio to walk us through that with Joy Connolly. And I think we can allow them to walk us through the highlights of the report, and then perhaps we can have a broader discussion. We've allocated a good amount of time in this meeting to have a broader discussion about the report, ask questions, and determine some next steps as needed. So Jen?
Thanks, Arlene. And I'll invite Joy as well to join me. I think maybe if Joy can talk a little bit about the process of engagement with the stack and what that looked like, and then we can take questions.
Okay, so it's a pleasure.
Does that work for you, Joy?
Yes, it does. So it's a pleasure to be here with you today. And I have to say, it was a total joy working with STAC. They worked really, really hard on this, particularly the subcommittee met many times. So just to tell you sort of what I did, and maybe as a starting framework, my idea coming in was to draw out and report on STAC's views as directly and as authentically as possible. So I didn't want to start with the preconceived structure. I knew I didn't want to reframe or revise tenant views. And so the best way to guard against that was to quote tenants directly. And so this started from the ground up, starting with what people said, and then working up to sort of the next layer of, and then what would be the recommendations coming out of that, what sort of principles and what sort of methods we talked about. So that was the overall process. I met with STAC at and facilitated the meetings on April 5th, April 26th, and May 16th. I also attended the March 23rd meeting, which was also focused on tenant engagements with Carrie led, and I reviewed notes from the February 18th meeting. At the meetings that I facilitated, my aim was to offer open-ended questions. Most of the discussion was in small groups to give ample time for individuals to speak, with very, very detailed notes recorded by Jen, Joseph, Wyndham, and myself. Once that work was done, there were 3 meetings with the STAC subcommittee of volunteers. I asked for 2 or 3 or 4 volunteers, 8 people volunteered, so it was a group of real keeners. There were multiple drafts that were reviewed by the subcommittee. They met 3 times with me, and I believe 2 times on their own as well to discuss the report. The comments that they had after these drafts were integrated between each meeting. I circulated a final pre-layout draft to the subcommittee, and then it actually did go to all STAC members on May 25th, recognizing that they weren't able to, at that late date, do a complete, sort of revision of the structure, but really to look at their own quotes to make sure that they were being quoted accurately. And then also circulated to my contacts at Tenant First and Senior Services. And I just want to say again, what a pleasure with Wyndham, Joseph, Jen, a total delight. So that's the process. There's one other thing I just wanted to raise because Maureen asked about it. And it was about the structure for tenant engagement. I would say it's true that I was leading up to sort of having STAC committee vote, on different specific methods around the structure of it. And I was advised, no, don't get into that kind of thing. However, on page 23 of the report, there is a statement about the structure for tenant representation. And I think it accurately reflects both where STAC members and the STAC subcommittee agreed and where they did not agree, where there was a variety of views. So what you have there, I think, is a fairly accurate representation of, at least among the STAC subcommittee, of where are we at this moment in framing out a structure or recommending a structure.
Jen, do you have anything to add before we open up
I
for
don't. Thanks,
questions?
Joy. That's great. We are open for questions.
I guess maybe I'll take the chair's prerogative and ask the question about, does STAC have some recommendations on the next steps, given some of the comments that were just made, Joy, in terms of that there was some opportunity for people to actually take a look at the report, that there's some support, and there's some question about some of the structure pieces?
In terms of the overall report, I think it actually be a very useful exercise to ask STAC at their next meeting what they saw as, I would call it the quick wins, things that you could jump in and do right away. On the structural thing, I think there are clearly some common ideas. There is overall support for, looking at it in a 3-step process, looking at the building level, at the regional level, and the value for neighboring buildings to be able to talk to each other, and then at the corporation-wide level. So that structure, I think, was widely agreed upon. There were some specific ideas where I think there was lots of agreement on, and some that will need discussion.
Great. And Jen, did you want to add anything before I open it up to anybody else?
I think Joy's got it. I mean, we really did see this as the starting point, and following with the members' motion from council to really gather the STAC together to present their views to the board, and then have the board and staff of the Seniors Housing Corporation take it from there to develop an engagement system that reflects what the STAC and what will work for other tenants.
Great, thank you. And maybe I'll open it up if there's any other comments, questions. Councillor Fletcher?
Yeah, this is, to me, I'm glad you said starting point, because I really believe that it is, Chair. And what's missing a little bit is what the current method is and what it has been for these senior buildings. Maybe can I ask you about that, Joy, where that's nestled in there and why we had to do this?
I think the experience that I had was really of seeing this as an opportunity to start fresh.
No, I understand, but I'm looking at what we're starting from. So if we're not clear on what it was, then what's going to be different kind of thing. Do you know what I'm saying? Yeah. And articulating what that model is, because we do have that report with the lists there. So I guess I'm all over tenant engagement no matter where I am. You all know that. So.
Well, I would say that so the recommendations, of course, are recommendations for what's next. Embedded in the quotes, you will discern what some of the concerns are with the current system. And those quotes are coming out of that and their hopes for change.
Yeah, so I guess I'm just going to say, and I don't know what we're going to do with this report, but this is coming out of this because there's quite a bit of strong frustration with the tenant engagement model. What was it? What is it? I've heard Carrie say so many times, stop calling it elections, because they're not elections, they're something else. So I'm not trying to go back in time. I always think it's important when you're starting off that you're clear on what you're leaving from and what you don't want to go back to. So that's one thing that I think kind of missing. I find it's very interesting to understand the kind of building, regional and corporate. What does that look like now? What would that be transformed to? So that we're really clear if that exists, doesn't exist. And we are pulling this thread through from another corporation. So if anything, I still would like to see that. I'd like to be really clear what we're leaving behind and what we're going to be doing differently. So everybody understands when I'm not here, when you're not here, we're all not here, that's still standing in the document. That's the first thing. And then I would think I'd like to see this go back to Stack to continue. And I don't know how long your contract is for Joy, but I think it's very helpful having you there as a facilitator. So I'll just ask staff, how is Joy's contract over, or are we still working with her? Are you still working with her? What's the situation?
Yeah, it's Jen here. I can answer that. I think that this report does complete the current contract.
So I think that, and what was it that Maureen said they'd asked to see something? Was it the RFP or something that they couldn't see? What was that, please? Who'd like to answer that?
I don't know. I didn't quite understand that. Joy, can you maybe provide
I
some
don't think it was an
feedback on that?
RFP. I think it was something about the structure.
The original project.
Sorry?
The original project, yeah.
I'm sorry, what do you mean the original project?
The structure, the outline of the original project, whether that was the RFP or how it developed internally, but what was the original starting point for the project? The description.
Sorry, I'm unclear. When you have an RFP, it's very clear.
It should be, yes.
When you're going
And that's
out
what Maureen said she asked to see, so that she could compare what the outline, the expectation for the project was versus, I guess, what's transpired.
Hi, if I may chime in for a moment.
Please.
Just because I received the request from Maureen, I believe that it's actually not related to this report. It's related to
Health
the
Commons
report from Health Commons, which is led by SSLTC.
Yeah,
so
right.
they may be better able to answer than the Tenants First team.
Sorry, that report, because I'm going to ask a question later, what the relationship is between Tenants First and the SLT team, because if I've learned anything, it's clear there's one portal, not five. That's you're asking for trouble at that point. So that's what Maureen was looking for, the ISM outline, not the RFP that put this project together.
It was the RFP for the Health Commons project.
Thank you.
Yeah.
Which was about the ISM, not the tenant engagement. Yeah. And then I guess I'm interested in what, pardon me?
I'm still here, Paula. The question that I raised around the engagement piece was, why did the city staff alter the direction of the report by telling Joy to leave the framework out? That was my concern.
And I think Joy wants to respond to that.
So that's the question I'm trying to find out. What got altered, or was it the ISM report, or was it the tenant engagement report? Which one was it?
Okay. On the tenant engagement report, what was different, I guess, through the staff's advice, for not to belabor landing on a specific and prescriptive approach or structure for tenant representation at the building, regional, and corporate level. So what is in the report, and it starts on page 23, is a statement around here are the things, and I use two different kinds of text. So in ordinary text, it's here's where people agreed. And then in italics, it's and here's where people differed. So what you have here, I think, is an accurate description of the discussion and sort of how it was left with Stack.
Okay. I'm finding that I can't wait till we're in person, because this is a very, very hard discussion today. And looking at the each building reps and tenant reps, there's these appended, and I'm not sure who did these appendix that we got with all the list of.
That was something we asked for the list. I don't think that's part of the report necessarily.
Well, these are the tenant reps as to what they are. So I'm just going back, and I'm really going to push on this. I want to see whatever was sent over from TCHC regarding the seniors and tenant reps. That actually is what we should be receiving, building by building. There are a million public reports that have been there for months, phase 1, phase 2, phase 3. I'm having a hard time that we now have another document, and one that appears to be organized northeast, southeast, northwest, they're all mixed up. 2 reps from a building are undivided, so the buildings aren't actually together. I'm just going to say I'm a little concerned about it. So this is the tenant representative people, is it not? Yes.
Yes,
There's
it is
nothing
contingent.
else. So that's what I'm actually going to ask for. I don't think we should be reinventing the wheel. We should be it's not like we're making new buildings. We're getting that building. It's not like we're making new charts. We've got those charts. And then let's take those charts and look at those as the basis for going forward, because it's quite different. Some of them have reps, some of them don't have reps, some of them have 1 rep, they're supposed to have 2 reps. It's divided by areas in the city. If we're in quadrants, then let's keep them by quadrants. And I just say that because everything's quite confusing. And if we don't have what I call anchored documents that are coming through, then we're going to get confused. We're starting new, but we didn't build all these buildings ourselves. There are buildings. We're taking the tenants, we're taking the staff, we're taking all the work that's been done so far and then doing something differently. This doesn't reflect all the work that's done so far, Linda. So I'm very insistent that we have that. And I don't know why it's not here, actually, considering that it should be.
So we will follow up on the supporting documents. I wonder if there's any other comments with regards to the report. Carrie, you've been really involved and we haven't heard yet from you in terms of next steps. What I hear is actually going back to STAC with some recommendations around priorities and a little bit more work into the next. Is that what you were thinking, Joy? And I wonder, Carrie, what your thoughts are. You've been really close to this work.
Yeah, absolutely. I think I heard Jen correctly earlier when she said it'll be good to take this report and then, sort of work on it. I don't want to see STAC's involvement stop at all. I think the STAC has to continue to be involved every step of the way, or else we're going to end up with the problems we were critical of at the beginning, which is going to STAC or other tenants after the fact and saying, we want your feedback. We want their input every step of the way going forward.
Great. And I wonder, Tom, to put you on the spot and welcome Tom Hunter to our first quality engagement committee. I'm thinking you might have some thoughts in terms of with this new corporation, and because I heard that it was very important. I think Bill mentioned that staff and tenants need to actually be versed in this first report.
Great. Yeah, thanks. So just hearing all this information, I'm just trying to, kind of put the answer, contextualize it for the discussion around, kind of that what is next. And so, one of the first things, of course, there's the report that we have before us today, and thanking the STAC members for their involvement and the staff for working, putting that together. And as people said, a very good starting point for us now to look at how we build what we refer to as our tenant engagement system. It has different names, but it's really about a comprehensive way to relate and engage with our tenants. I think too importantly, and as the councillor raised, so we need to create where we are today. So we need to establish what is, we know the STAC and the tenant leaders, what is the representation in the buildings, how are they currently interacting. I think and then my also understanding from looking at documents is that there will be further tenant consultation on the STAC report starting later in the summer into September, so that we can continue to build out this framework. So we identify where we are. There's the information within the report now, and it sounds like the staff will continue kind of to work on that. But I think simultaneously, we're going to want to look at how do we get. Oh,
no, go ahead. No, I've just got my hand up for after you're done. I just letting Linda know. I'm sorry.
And then how we're going.
It's a hand up. I'll use that thing. Okay.
We're going to take this in consultation throughout the buildings and to our tenants, right? Because this is the stack is one very representative group, but there's the tenant leaders. How do we make that inclusive? And so I also want to ensure that this team, and we are now, that the whole tenant engagement is it won't, we're not going to wait for this. The framework will be what we want to work towards, but we're already really focused and engaged on, and don't want to lose track of the importance of tenant engagement. So I've heard around funds for the tenants in the buildings for their for summer activities, capital projects, ensuring there's good communication with tenants, any of our tenant facing policies that may come forward that need to be, we will engage staff or tenants in those at this point in time. So we are committed to that ongoing engagement. But once again, to the point around what next, there needs to be the work around the stack and the report, and then going out to the tenants with the framework to get further definition around where we want to land for the engagement in the entire framework.
Thanks, Tom. I appreciate those comments. And Councillor Fletcher?
Yeah, I appreciate that too, Tom. I'm just going to go back to my original point. Number one, what does it look like right now? We love to dream things up. But you can only dream up what you've got. We could dream up brand new buildings, but we have the ones we have. So how many meetings have tenants had? Which tenants have actually been to a meeting? Are there any building committees in any of these 83 buildings? The things that I really appreciate about having 83 buildings is it's an economy of scale that you can actually find out very clearly what's going on. There's 4 quadrants. It's even down to easier to know. That's kind of what I really think, whether the stack's going to do that or we're going to have that report attached.
Yep.
This is the wish list. Let's start with what's happening.
Yeah,
And then on top of that, which buildings are still, which rec rooms are opening? I'm going to ask that under ISM. And so if I'm sounding a little rough, it's because I just believe we have a starting point, and I don't see it here, the appended, number one. Number two, I think it's probably a good idea to have that conversation. That stack would have that information. They're going to know, okay, of the however many buildings, 83, there's supposed to be 160 reps or 120 reps. How many of them have met? What have they done? Maybe none have met. So what do we do with the people that are there? Are we going to have a big meeting of all those people? I think there's some discussion about having a really big, not a convention, but get everybody together and look at some of this. But we still need to know, some of them aren't active. Some of them have their name on a piece of paper. Some of them are very actively engaged. It's not all the same. And so I'm backing you up, Tom, because right now we have a great idea, but we don't know how to implement it. So some of that nuts and bolts that's missing here, I'd like that to go back, however we see that. And I understand when you say you want to ask all these tenants, I have no idea if they know anything. I have no idea how involved they've been or what they know, possibly nothing. So that's the first thing we need to know before we say we're going to ask all of their opinion, because they've not been very involved. And with the year delay off, they've not been involved. And with the pandemic, they've not been involved. So what does an implementation look like? I'd like to know who's in charge of this. Is it tenants first? Is it the corporation? Is it you? Who is it? That's a question I think is pretty important. So could I get that answer? Sorry, I'm.
Yeah, and we may need to ask the city for. I know Paul's not on the line today, so I think that I agree with you, Paula, in terms of the tactics. It sounds like what we have to do for the board meeting is actually be a little bit more specific about some of the tactics going forward. Having had this more broad report that has come to us today, with some appreciation.
You're breaking up, Lynn.
Arlene, any comments from so you hear me? Nope, you can't hear me.
Brenda, I think you should turn your microphone off, Brenda. It might be interfering.
Try your camera.
Are you okay, Linda?
Oh, yeah, can you hear me?
Now we can hear you.
Okay, sorry, I am actually out of the city, so it might have just been the the wires. So jump in, Arlene, if you need to. So next steps, I think we're at this point. In terms of taking, I think what we want to approach. Did you want to make another comment, Paula?
Yes, just in case, before you wind up with the next steps, I want to see the actual reports that are broken out, senior reports, go to the board with that information for the board, since this is going to the board. And I'd also, that's really important. Thank you. So we know it's.
Thank you. Thank you. And Brenda, were you trying to say something? Go ahead, Brenda.
Can you hear me? Hi, can you hear me?
Yep.
How's that? It's a technical question. The report here done by Joy details quite a lot of good stuff. Is there going to be a separate thing regarding recommendations or next steps? Will it be this meeting, or will it be referred to at another meeting, either the board or the committee meeting? That's the one technical question. And my second technical question was somewhat related to the Health Commons report.
Yeah, can we get to that item when we get to that agenda item, Brenda?
Okay, that's fine. I just didn't, it seemed, it's there, but it didn't seem to have a
Yeah. Okay.
bookend there as to what's next, right?
Yeah, thank you. I think that I'm here pretty well consensus that the report was really helpful in terms of actually giving us some really meaningful information on where tenant the stack is feeling that there's priorities. But we need to get a little bit more specific when we get to the board in terms of next steps. And Paula, you have also asked for some additional information as well.
Okay, thank you.
All right, so what I'd like to do is ask for a motion to approve this for information at this point, noting that we will actually, more work is to come, and that we are recommending that it go back to stack for some advice on the priority setting.
Thank you. I'll move that as long as we get the other document.
And thank you, Paula. Seconder.
And also to understand where the governance lies here. Is it still with the DCN? Is it with Tom? Where is it? I'm unclear on that. So let's have that clear for the board, please. Thank you.
Yes, and perhaps actually, because this came from council, it might have, we actually probably need some direction from the city on that as well in terms of the next steps. Thank you for moving that. Can I have a seconder? Lawrence, Carrie, Jim. Thanks, Jim. All in favor? Great. And we do have the next report is the ISM. I do see Sophia on the line, and maybe we could actually, do you think it might make sense to go to the Health Commons report since it actually has been referred to? And then we'll come back to ISM if I'm not messing things up too much for those that are doing that. Is that okay, Arlene?
It's fine, actually, Paul. Last I heard, Paul would be available after 4. I don't know if that's changed, Jen? Andrea, sorry.
No, he's in.
I don't have information about that. I'm not sure if Andrea does.
Yeah, he's in the mayor's review of council agenda until 4, so he'll be with us moments after 4 p.m.
So we can move ahead with the Health Commons report then. Thank you.
Okay, so this might work out better. So Sophia's here to give us an update, and this is actually an interim report. I think that it's important actually, rather than actually seeing it as an ending. And who would like to introduce this?
So I'm happy to welcome our friends from Health Common to the table and ask them to provide us an update. I know that their work has been very deep and very meaningful, certainly from what I've been hearing from the staff members. And we wanted to bring forward this interim report, and it's my understanding that this is a bit of an update to this committee, so that a more detailed update can be taken to the board at the end of the month at the June 30th board meeting. But in fact, the final report from Health Commons will not be coming forward to Toronto Seniors Housing until later in the summer. What they'd like an opportunity to do is to present their update today, get any additional feedback from this table, present at the board meeting, and then also have an opportunity for feedback at the board meeting, and then incorporate all of that feedback into their final report that they will bring forward in September. Hopefully, Sophia, I got that correct.
Yes, that's right, Arlene. The only thing that I would add is that we have a planned meeting already with STAC members in July. So there's a meeting at the end of the month to incorporate board's feedback on the actual substantive content of the work that we've been doing today. Was really meant just to be a process update. So you see a heavy focus on process, although we did allow for some content to creep in there. And then we do have a planned meeting already with STAC to integrate their feedback along with what we have heard from the board. And all of that will come together for the final report. So I'm not sure if somebody's sharing slides for me.
Just Sophie, I'm just going to interrupt for a minute. I believe that
please.
Bill has a deputation. We should probably do the deputation first, right? So maybe while we get the slides up, we could actually swing it over to Bill, who's on the line and was holding his part. I'm not sure if you heard some of the comments that Maureen made earlier about this report. But Bill, yes. Bill, great, perfect. So Bill, do you want to add your comments before we get to the presentation? Reggie, are we able to unmute Bill?
Linda, Bill has left the meeting. If you need, I can pass him in again.
Okay, well, let's just go ahead then. I saw that there was a deputation, but I think he made some comments. I'll pass it over to Sophia.
That's great. Thanks very much. I can share my slides unless somebody from the committee will be doing that.
Rajni,
or Sonia.
Rajni,
Sonia can also share. Yeah. For the health comments, actually, Sonia, could you share?
Okay. Give me a minute. I'll bring it up. Sure.
Oh.
Thank you. Thank you, Rajni.
That's great. Actually, it just gives me a moment, I think, to address some of the questions that came forward, although I think, Arlene, your introduction did help with that. So today is just a process check-in. We wanted to speak to the committee. There has been, I think, some substantive changes that were made to the work plan since the beginning. So we came March the 8th and talked about our desire to engage with STAC and with tenants about how they wanted to be engaged, which was the first question. And when we initially put together the work plan, I think what we had anticipated was that there was a keeping the STAC in the loop plan. And of course, once we heard from STAC members and from tenants, it was very clear that actually the objective there was going to be to integrate STAC members into our approach. And so there was a fairly substantial diversion from the original work plan to incorporate STAC members on the Health Commons team as we went through this process, and I can speak to that a little bit just as those slides are coming up. So I think there are some questions around what the original intention of Health Commons involvement was going to be, and I can speak to that. We were brought in initially to lead an engagement with STAC tenants and other stakeholders about the seniors health and wellness model component, specifically of the ISM. And we heard from the city that we were and from tenants that there was a real desire to understand their perspectives on health, recreation, social needs, and really what would make it easiest for them to access a diversity of services in the ways in which they wanted to access them. So there's an aspect around desires for and aspects of that service offering that seniors want to have, tenants want to have. But there was also, I think, an interest in understanding what the barriers are to accessing services, what is perceived as a barrier, because I think everybody's got different perspectives on that. So all of this information is really meant to inform the city and Seniors Housing Corporation for their future planning around this model, and to really include this as part of the ISM. The question was, I think, for the city was, is there a removal of this piece altogether, or is there a modification to meet tenants' needs? Where are we beginning? So that's where we started this process. And I think it's important to acknowledge that we've had a lot of important answers around where to focus the report back. And so I'll be sharing some of that. We included a few quotes similar to what Joy had talked about. There's really no better way actually to hear where tenants and staff members are at than to hear it in their own voices. So we wanted to make sure that we're making the slides accessible. We were only able to include 6 quotes here on this slide and on the next slide, but the overwhelming message that we heard was that there is a desire from staff members and from tenants to have a better sense of what the full picture is so that they can really engage in the plan. It's difficult to be able to do that without a good sense of what's going on. So that was very clear. They did appreciate the opportunity to be able to engage with, I think, with folks that were from outside of the regular structures. So that it felt much more neutral coming in. And there was also, I think, a very clear message for us that there is a real difference in the way that individuals define health and wellness. And that definition is a very important place to start. If we assume what people need and what services will be tied to our own definitions of health and wellness, we're likely to miss the point. And I think one of the things that we have heard through this process is the reason why engagement is so critical is because tenants and staff members have to be able to make sure that we are at the right starting point. I heard Councillor Fleischer talk about what came before, and I think that that was really expressed in this conversation. We don't want somebody else's definition of health and wellness. We really want to be able to define that ourselves. So I think you'll see, and we'll share in our slides where we did deviate from the original plan. Initially, we were talking about keeping staff members in the loop, but as they expressed a desire to be much more involved, we made an offer to staff to any members that wanted to join our team that they could. So there were 10 staff members who volunteered to be part of working groups. So we created 2 working groups of 5 so we can make sure everybody could be heard. Since April, we've hosted 17 meetings with staff members. The initial one was just the launch and the co-design. Subsequent sessions were working sessions with 2 groups of staff members. Each meeting was about an hour and a half long. And there were 2 of those each week for 8 weeks. Some of the themes that came out of our conversations with staff was that independence and neutrality really mattered. I think they appreciated that being incorporated into the structures and receiving information on an ongoing basis. So it didn't feel like it was just getting dropped on them, at a touch point or at the very end. I think there's been broader questions around how many folks we're able to target and speak with. And I think it's important just to acknowledge, and I think Arlene talked about this at the very beginning, our goal with this process, and it always has been, was not to go broad but shallow, but instead to really be able to get into conversation and dialogue with tenants about their desires and about their perspectives on health and wellness. So through this process, we have reached 80 independent tenants, individuals. We've had 10 focus groups that were ranging in 3 to 5 people. There were smaller groups so we could really hear from people. We did host focus groups in Vietnamese, Cantonese, and Mandarin to ensure accessibility based on the languages that were requested. Over this process, we've done 40 interviews, of which 20 were extended in length. So we do have a very rich repository of information, and all of those interviews and focus groups were in addition to the 17 meetings that we've had with staff. So this is not about going very, very broad, but really going deep and really trying to understand people's perspectives, what seniors care about the most, and how we can support seniors well-being on their own terms. So if we can, actually, I'm just going to ask you to go back up to slide 4, please. I think a little bit higher up, please. If you can keep going up. Yeah, right here. That's great. Thank you. So I just wanted to talk a little bit about the initial and the emergent goals for engagement. So it was really beneficial for me to get the chance to listen to Joy Connolly's presentation around engagement. For us, there was a very specific set of questions that we started with around co-designing a health and wellness initiative, trying to figure out whether or not we needed to begin from scratch on the ISM, the health and wellness components. Was there just changes that needed to happen? So that was the initial engagement goal. And it was very directly connected to sort of sharing back what we heard from tenants. The other, I think, emergent goal that has come out of this process for us is to be able to reflect the context and the stage that the Seniors Housing Corporation is at now. So I heard Councillor Fletcher talk about the fact that, the buildings are not new, the tenants are not new, the staff are not new, but there is a real desire for change and for a signal towards a change. And the ways in which that must happen, we believe has to come through this engagement process. And that is clearly a theme, I think, in your conversations. It was very evident to us as we were out talking with folks. So if it's going to be a brand new seniors housing corporation that does feel different, what can change are the processes around that. And so we see the engagement is not just a way to understand the design services, but as a way to really signal a real shift in the model and in the introduction of the corporation. So we acknowledge that, at the beginning of June, the corporation came into effect. There is a real desire for a signaling of a change, something that feels different. So that became a goal for us through this process. I'm just going to, sorry, it's very difficult when I can't control the slides at the same time. Could I ask you just to advance 2 slides, I think? A little bit more. No, sorry, go down, please. Thanks very much. No, sorry, no. I wonder if would it be easier if I shared the slides? Would that make it easier?
Sure.
Okay.
Can we hand over hosting to Sophia?
Thank you. So I'll just bring up mine here. Great. Can you see that now? Thanks very much. So just moving from that, sort of what we saw as the goals of this engagement, I'm just going to speak really briefly about the fact that this process has evolved. I think I talked a lot about that. We wanted to make sure that we were really incorporating the desire of STAC members to be present in the process all the way through. That doesn't end. So we've finished our 8 weeks of development work. So we've gone through the process of recruiting, hearing from folks, reading through all the pages of transcripts and beginning to try and make sense of those, sharing back those insights with STAC members. At each meeting with the STAC members, we shared materials in advance, and then we did our best afterwards to summarize what we had heard as sort of notes on those materials so that people could sort of check to see whether or not what they had shared was properly reflected. Today, we're checking in with you around our process just to ensure that everybody's aware of what's happening. There will be a presentation to the board at the end of June. We'll be going back to STAC with the report for their review and to incorporate their feedback. And then we'll be submitting the final report. So I think I just wanted to share a little bit of a preview of the emerging themes, even though we're meant to be focusing on process, because I think this is a good opportunity for us to also hear from you whether or not we're on the right track. Similar to what Joy had talked about, we're sort of sharing 2 levels of recommendations on the 30th. The first is really that there's a need through engagement processes and through this process around the integrated service model to really begin to build trust through a culture of respect and through mutual support. So, all the way through our content, you will see that the problem statement that we end up focusing on is really the necessity of integrating seniors, tenants, STAC members into the design process, and recognizing that each individual and even each building, each region is going to have a slightly different flavor, a different set of expectations, and that those expectations and desires around what their service model looks like should be reflected in the model that is presented to them. So we focus a lot on the feedback that we heard around what needs to be true in order for this culture of respect to be reflected in the content. And then we go into some of the specifics. So we did hear very specific things from seniors in the buildings around their priorities and around specific improvements that could be made. And I would call those also quick wins, things that could happen more quickly. Then that might be evidence that there is real listening to the requests around what seniors value and feel are really important. We also, I think, an important theme that comes all the way through, and we were reminded all the way through this process, that when we're talking about these spaces, we are talking about not housing, but people's homes. And so there is a need to try and get as specific as possible in responding to the very personal expressions of what people want out of their service model. And so that will be sort of also integrated into the report. So you can expect, I think, 2 levels of recommendations. One, which is really processes and tools to support an engagement process that will, I think, help you launch into a design process with the individual regions or the individual buildings around what the service offer looks like. And then you'll also receive a series of recommendations that are very specific around some service improvements that can be made, specific responses to what we heard from seniors around what they want from that service offer. So the timeline is here. I think I spoke to that a little bit. We'll be submitting to the Seniors Housing Corporation for board approval that final report in September. And I'm happy to take any questions now.
Great, thank you. So I think I will go to Brenda and then Paula, and I think that you've come with some specific asks to make sure that we're supportive of the direction that you're taking. Brenda, do you want to jump in?
Yeah, thank you. Health Commons was asked to come in looking at the integrated service model, and in particular the hubs. Have you to date been able to get any feedback on that or addressed it specifically? And is there anything you can share with us to date, or is that still evolving in your consultation process?
So I have Sonia here and she can speak to this. I think our intention was to reflect what we heard back. So what we have heard very clearly is not an attachment to the concept of the hubs, but actually a desire to have a service offering that reflects what tenants in that specific area are looking for.
Right.
So in some cases, it may be an integrated service hub. I think the composition of the services that are offered, which service providers are coming in there. I think we had heard very clearly that people wanted that to be part of the dialogue. In other cases, we also heard, and I think there's a thread throughout, that often security concerns come up. This is not housing, this is our home. We also heard those things. So we want to really reflect those things. I think that there are certain instances in which you will find tenants in a building feel like the most important part of access is hyper local, like inside their building.
Sure.
And what they want to comment on is the service mix or the service provider. In other cases, that is not what we're hearing from seniors and tenants. They are concerned about security. They're concerned about the home environment. And so they have a different request. And so I think that is the reason why the focus of our recommendations is how do you create a process so that you can actually really, I think, customize what that service offer looks like. The overwhelming message that we heard was whatever comes in as the service mix in whatever form, it must be driven through a dialogue with tenants around what is reasonable. So I think for their perspectives around these are the things that we're willing to sort of maybe compromise on, and these things are not open to compromise, and a process that really respects and honors that, I think is what's critically important.
And related to that is the specific issue of personal care services, what we call personal support workers providing personal care. Was there, you mentioned what we call health and wellness may be different than what other people call health and wellness. Was there any discussion about actual hands-on personal care services? And was there any, I don't know whether there's a need to talk to Linz about this, but it seems to me if we're going to age in place, we will need these types of direct care services over time in buildings or in regions. So I didn't know whether you were able to tap into any questions or queries about that specific service.
Thanks for your question, Brenda. I think just really quickly, I want to separate what you'd said into two parts. I think one is just speaking to the definition that we heard from seniors around health and wellness, because unfortunately it's something that I missed in my presentation, but is important to share. Their definition of health and wellness is much broader than we would normally. We would describe it from a service offering perspective, often in systems. A critical component of that, of a sense of well-being, is feeling heard and respected and being part of the process. Another component of it was feeling valued and having a sense of purpose. So we heard a lot from folks around the process of aging in place can be supported by more than just service providers, that individual tenants have a lot to offer, that there's a lot that they can put in place. So thank you for actually opening the door, because I wanted to go back and acknowledge that there is a different definition that we're working with here that is very much driven by seniors. On the
Yes.
specific question around,
It's not just specific services. It's
that's right.
well, it's a sense of building community.
That's right, and
Oh,
agency.
Yeah.
And agency. Sonia, I'm going to ask Sonia to speak directly to the question around personal care supports and personal PSW work.
Yeah, I would say that one of the ways this element has showed up in the conversations we've been having with seniors has been really about this idea of what is the service I need and in what location should I be getting it. So people did talk about, and to report back on this if it resonates with folks.
Hard to hear you.
But, hard to hear me? Okay. People did talk about this idea of what supports and services do folks want inside their unit in the privacy of their own homes to help people get through the day-to-day, and how those things can change over time as needs change. So, and that being a very important sort of bucket of services that may include, of course, personal support. In addition to that, people talked about sort of what do they want in the context of their building. They want something that's about the building community and the wellness of the community and connection, and is very local and located really close to them and in their building, and what specific nature or criteria of that environment to support wellness will look like. And then there's the conversation around what are the supports and services that people actually want to leave the building to access and get somewhere else. So there is also this notion around hubs existing in other ways, shape outside of the building itself, and how can we support access to those when the supports and services are located somewhere else, and they should be, and that's a really, we want to support the access piece to get those supports and services. So one of the ways we're seeing this conversation show up is the where am I and where do I want the service to reach me where I am. And the personal support came up in that sort of privacy of my own home element for sure. But it's not the only thing.
Thank you. Thank you, Sonia. I'm going to pass it over to Councillor Fletcher. Is that your hand up or is that a legacy hand?
Oh, no, it's everything. Yeah, I'll take my legacy hand down. I'll lower that hand. Again, I'm just going to say what I said before, and that we're transferring the buildings, we're transferring the people that work there, we're transferring the seniors, but we're also transferring everything else that's gone on there. We're transferring all of that and all of that information. So for me, I actually want to see a report that says, this is who's in this building. Why I'm so keen on this, and I've mentioned it before, and if I'm sounding a little frustrated, I'm sorry, but when I go in a building in my ward, and then I find that there's 5 different social workers in there, and there's nobody that they report to with what's going on with that tenant. Like, this is not rocket science. This is not calling in the LIN. This is simply getting a grip on what's going on. And then somebody that's got their diapers on the floor, somebody who's got a wife that has dementia, these are everything that's going on there. So where's that captured? All of these new systems, that's great. What is the bottom line? What does the floor look like before we're building the rest of it? I don't see that information. I'm not asking Sonia that you should have, I think that should have been transferred over. I think the reports on bed bugs should have been transferred over. I think the reports on the tenant elections should have been transferred over, as those are public reports. We shouldn't be doing everything again. So that's what I'm going to ask for. I'm going to ask building by building. I want to know what's going on in there. Which services exist currently in those buildings that we're going to call health-related services? Who's providing them? Seriously, if somebody says we don't have that right now, come on. We've been here for a year. Where is that information? Let's append that to the ISM. Then I'm going to say what exists in each building, because we're transferring all of that over, and we simply need to know. I agree with Brenda and what you said, Sophia. The seniors look at health, we're talking about the LIN all the time. We're going to bring the LIN, we're going to do this LIN. What the heck is wellness? Wellness is not having 3 times as many bed bugs in a tiny little wee 83 building group as the entire rest of Toronto community housing. To me, that's a wellness start. And if I'm a tenant, I'm going to say, stop talking. Let's walk the walk and take one of these things like the bed bugs. And I sent that report over to you, Linda, and I'd like you to table that along with this so that right away tenants know we are starting. Every building, which buildings have the worst? Which are the buildings that have the worst? Who's in there? Where are the bed bugs? Where are the problems? Why are they still there? What do those tenants need to be helped? Obviously, senior tenants have a really hard time with bed bugs, harder than everybody else. It's just the number one thing. Now, I didn't hear anybody talk about that, but I hear that all the time. So I'm going to flag that, and I want us to tackle that, Linda. If we're going to do our job, I think we have to tackle that.
We'll table that into the report. So I think I'm going to pass over to Carrie, because I think we also have an ask from Sophia and her group in terms of the report that they're coming together. And I think that some of this will actually also dovetail into the conversation about ISM. Carrie,
I thought we were talking about the ISM.
Right now, we're talking about Health Commons report and their ask for address, which is actually we're moving to the ISM report after this.
Okay.
I think it's part of the ISM report.
Yeah, it is.
It's a layup. It's a basketball layup for the ISM report. So maybe we should be talking about them together.
Yes, I see them all three connected, Paula. Absolutely. I think we have actually contracted Health Commons to actually do a specific project for us. So, Carrie?
Yeah, thank you, Linda. And Paula, I couldn't agree more. But a specific question for Sophia. This has come up a few times in STAC and with other senior tenants. Will they be asked specifically how much of their space they are willing to give up, and in how much time as well? I was delighted to hear you say, that one size doesn't fit all. You're going to have to see what works for each building, each sort of area. But tenants are concerned about that. How much am I going to have to give up to consider hosting something that looks like a hub, or hosting something in my building, because the memory of Greenwood Towers is fresh with a lot of people.
Thanks, Carrie. Go ahead, Sonia.
Yeah, I'll just jump in on this point.
Okay.
I've been asking people this exact question and have heard a lot of responses. And what I will say is that, responses vary, of course, because people vary. And what is very clear to me is the message that I have received is not that anyone wants to feel like they are giving up their space in a long-term, 5 days a week kind of way. People have been talking about maybe 1 day a week would be great, or 2 days a week would be great, or maybe the mornings would be great to offer to service provision exclusively. So the answers are pretty fluid, but I think what stood out for me when I look at across the responses that I heard, knowing that we're talking to people in different buildings and different environments, is that the idea of sharing the space that is there for tenant activities, as well as for any service provision that community or that building decides is the right fit of services for the people who live there, that needing some support and how to make that logistically work would be really helpful. So the idea of somebody paying attention to that and to really organizing the sharing of space, because people do want access to the space, and this notion of giving up space, if we could put it that way, is something people want to negotiate at the building level. So what I'll say is that a coordinated effort around that is what people are craving, and but sharing the space is something that is sort of universal, even though some people say a little more time or a little less time.
Okay, but the questions are being asked. That's the
Indeed.
That's my main concern.
Are we going to get to dispute on this?
Oh, sorry, we had you
Bill?
previously. I'm sorry, Bill. We were trying to reach you earlier and you weren't on the line. If you would like to go ahead right now, we can make sure that you have the opportunity. Thanks, Bill.
Oh, I'm sorry. I wasn't aware that I was live. Thank you very much, Madam Chair and members and everybody present. Very interesting conversation. And well put, Councillor Fletcher. There's been, throughout this whole process, I've raised the issue of silos and about how everybody is working in their own separate domain with their own focus and their own agendas. And what I'm hearing here is that absolutely nothing has changed in that regard. No, the policies that are in place are the policies that were proposed 2 years ago. There's been absolutely no change on your end and the end of staff, okay? Tenants, on the other hand, have gone out of their way to be involved and to try to have a voice in this process. Now, what I've heard so far from, from Joy and from Sonia and Sophia, they very valid and very useful information, and I think we are all the better for it. But as we also heard, that there is a focus and there is an agenda to the mission that these folks have. And it is, and it is not necessarily to my best interest. I just listened to Sonia talk about the use of space. That is a critical issue. And it is not a building by building, maybe, maybe not. It is an issue that this is our space. We have a legal right to that space, and that we are willing to share that space. And what needs to be understood is that it is our space. It is not the agency space that we get to use. So what I'm still seeing here is a lot of the old attitude about tenants for tenants, but not with tenants. Okay? In regards to the presentation now, we have absolutely no idea what anybody has said to Sonia. We're the STAC committee that signed on to be a part of this process. And I thought part of that was going to be looking at the information that everybody was putting in, not just tenants. I know a lot of that. I wanted to find out what staff interest is, what agency interest is, what city interest is. Because from the beginning, that has been the problem, folks. That it is in all of your interests, and we're not included. Okay? The next step that needs to occur is there needs to be staff accountability to tenants. We need to be included. And it is about those very issues of the bed bugs and the cockroaches and who's coming in and out of our buildings. That is all about well-being. You each have that in your own homes. So, I mean, we deserve the same. So I think, at this point, all of this information, plus all of these focus groups, and the simple fact that clearly there's been a problem with getting lists. How can you sit there talk about how you want to include tenants when nobody has pushed to get that list for me? When I asked for it 9 months ago, who's going out of their way to go to go to Jag Sharma and say, give me that list? They need it. It is part of this process. Tenants are supposed to be included. The fact is, and I'm very pleased that Mr. Hunter is going to be doing a tour of the 83 buildings, because that is what's needed. That is what all of you need to do. That's what staff need to do. You need to get out of your own pockets, your own little pockets that you're in, and you need to step out and see what else is out there. Because there are people who need a lot of help, and then there are people who are willing to help. So let's collate all of this information and get to work. Thank you.
Thank you very much, Bill. I think, I just want to say that that the reports that are coming to us today are coming to us fresh as well, to the board members, and I think that there's some obvious work that we all have to do moving forward when we have this information. I know I just want to tie up this conversation. Sophia and Sonia, is there anything else that you need from?
Sorry, I have a question. I have a question for the deputant, Linda. Sorry.
Go ahead, Paula.
Thank you. Are you there, Bill?
Yes, I am, Ms. Fletcher.
What list did you ask for again? Just remind me, please. 9 months ago.
Excuse me?
What list did you ask for 9 months ago?
I asked for the list of tenant leaders. The list that you were holding up with the names of the tenants and who's the leader in the buildings and whatnot. I was asking for the contact information of those individuals so that we as STAC members could start communicating with them.
Got that. Thank you. And would you expect to see a little overview of the initial hub and what went wrong there somewhere written down for history, or is that important or not important?
I believe it is important.
Thank you.
You know,
Thanks.
Yes, thank you.
Any other questions to the deputant? All right, are we able to just, I'm cognizant of the time and do want to actually also hear from the ISM. Is there anything else that you need, Sophia and Sonia, moving forward?
Just very quickly, we do need approval to be able to come forward to June 30th with a draft of the report and our recommendations. So we need to ask you for your approval to prepare that presentation.
I have to ask for something more in that report, and I have to have an overview of what happened with the placing of the first hub, because it fits in the ISM, it fits in this, and of course it fits in tenant engagement. And nobody's ever kind of fessed up that, wow, is this how we're going to do this? So I see you're nodding, Carrie. I'd like that there, because at Greenwood I heard nothing was wrong. And I do think that there was a big overstep there, that this is one of the reasons the placement of that hub and the approach is one of the reasons why we're doing all this other work. While Sonia's team is there, while Joy's been hired, is to get down and say, how are we going to work with tenants? What does that look like? Because it was a problem. And the issue of space.
Would we be able to get that? Because I think that it's not really fair to ask Sophia's team to provide that, because it's actually historical.
Let me ask the DCM then to provide that. And then the other thing is, because we're talking about space, Linda, and we will in the ISM, but just as I mentioned earlier, we have no idea what goes on, what has gone on in any of those rec rooms. They're opening them up now. What's the role? We need kind of a bit of a roadmap before somebody moves in and does everything again.
Sure.
Where we're behind. So
and maybe we can make sure that that's on the agenda for the next meeting, because that actually is.
No, I'm asking to have that go to the board. This information is out there. I'm sorry if I'm being hard today. We've had this information for a long time. Where is it?
So can we put that on the for the board, please, for just an update on what's happening with the spaces? I think
83 of them. Thank you. If there's nothing, we can hear nothing. Thanks.
And I think, Sophia, in terms of Brenda.
Yeah, I support Councillor Fletcher on that. Some detail as to what happened and what we can learn from it. And at some point, some accountability. I don't know if we'll get that right away, but who was on first, what happened. The thing that I'm very cognizant of is in terms of the use of space and shared use of space. is access issues and safety and security issues. I mean, it's one thing to service your own community internal to the building, but I think there had been a concept built into the idea of the hubs that they might then become in turn community hubs, if I recall.
Yes, they were. That's
Yes.
all they were.
Yes, that's something I read in the original reports.
4 of them, only 4 for the whole
Right.
city, people coming in and out, and the tenants had a freak out because they
Yeah.
don't want people in and out of their building they don't know.
Yeah.
There's enough people in and out that they don't know.
Yeah, yeah.
So,
no,
so,
I
so yeah,
so
I think
for
what
me,
we're
it's important to
hearing,
get some level of detail of what went right, what went wrong. But
right? So
stick with
yeah, so
that
I
in the
think
future.
what we're hearing and supported by Brenda, Carrie, Councillor Fletcher, is that without actually some of the context, it might be hard to actually move ahead with the report, Sophia. But I think that we do want the work to continue. I think that the work that you're doing in terms of engaging people, I think Stack is also wanting to hear back. I worry about the June 30th deadline or date with all of that. But Arlene, any thoughts on your part? Because you've been kind of overseeing these pieces coming together.
So I think we'll, in terms of what Councillor Fletcher is asking for, it's a matter of just pulling back some documents, pulling them together. The documents, for the most part, they are there. We just didn't, unfortunately, specify them with this report, but we should be able to pull some of that together. And the inventory of space usage across the 83 buildings, I'll check in with the team as to what we can actually report on by the end of the month, because I know some, as Councillor Fletcher alluded to, some are open, some are being accessed, and some are not. So at least we can provide that information as to where each building is at.
Thank you, Arlene, but I'm also looking at what was there before the pandemic. Let's understand what historically has gone on. We're taking the buildings, taking everything that's gone on before. We're going to do something different.
So you're going to do your best to pull that together. I think the question would be, will the board have the ability to actually hear the report from Health Commons with all of this, or do we need to actually push it back? Any thoughts on that?
So, sorry, was that directed to me?
Yeah, I'm just trying to answer the question that Sophia and Sonia raised in terms of approval to move ahead with providing the next phase in your report for June 30th. I think that we can do that. I think that we need actually context information to actually, because otherwise we may go around in circles.
My guess is that the context that's being asked for is probably part of the initial RFP anyway, offering some historical information that then would give context to how you go about doing the work. But certainly we can work with the deputy city manager and others to pull that information together to provide that, because I think what is being requested is it's historical information.
Right.
I'm just going to ask, was that never requested earlier, or it's not in your, do you not have that in preparing for the handover? Is this not all somewhere?
Do I personally have
like in the cupboard, like in the cupboard, where you open the cupboard and you say, okay, we're taking this out now for this. That's, I guess it's not all there.
I would have to just check in. I haven't personally seen all of the contextual information,
okay.
So I won't comment on whether it's.
You'll look in the cupboard. I'll look in the cupboard, Arlene. I'll open the cupboard and see what's in there. Yeah, thank you.
And Paula, I think I did ask at one point for an inventory as well.
I recall that, Brenda.
Space usage and stuff, and I don't know where that is at, but I'm very respectful of the process issues, with Health Commons, and I think it is important about building trust and engagement. But the rubber hits the road at some point, and the practicality of things and the implementation ability of things are important concerns for me, and I always want to be grounded in what steps we can take or should be taking and what decisions we should be making in the short run. Show a few wins, like maybe increasing the budget for the tenant fund, just to show some goodwill, right? And things like that. So I'm just always aware. I like Paul, I like to know what happened, what's going on, what we are inheriting.
All right, so we will work with you, Sophia and Sonia, to get the information for that that context. I think that I would say proceed. I'm not hearing any opposition to that, and so can I have an approval for this report, this interim report for information, and that Sonia and Sophia have our support to proceed as they have actually laid out. I have some. Carrie, anyone?
So moved. Sure.
Brenda, thank you.
And to get them
all in
some of
favor?
that anchor information,
Yeah.
that'd be
Yeah,
good too.
great. Super. Thank you so much. I think that this is like we're getting into the meat. I'm reminding myself that we're 13 days in as a corporation, but we have all of this great history and information. Actually, even the work that this is new work that will actually help us to land. I think we're going to move back to the ISM, and this was actually a request from Councillor Fletcher to have to make sure that our committee is actually aware of the work of the city with the ISM. And I think, Arlene, are you setting this one up as well?
Thank you. Yeah, well, Linda, I think you set it up very well.
Thank you.
At our last meeting, Councillor Fletcher had requested that we bring forward a report from the city as it relates to the ongoing role of the city related to ISM and how that intersects with the work that's going to be done at Toronto Seniors Housing. And so DCM Paul Johnson is here to provide us with that information.
Thanks, Paul.
Thanks very much, and we'll get the slideshow going here. Hopefully, folks are you able to see the slideshow?
Yes.
Perfect.
Yes, Paul. Yeah, Paul.
Okay. So I'll try and roll through the slides fairly quickly so that we can get to some discussion as well. And so we're here to try and do a few things. And let's see here. I can get stuff going. Now, are you seeing the slide, just the slide alone, or are you seeing my presenter notes as well?
No, just the slides.
Perfect.
But if you want to share the notes, go ahead.
No, it's all good. Then you could just read along with me. So we'll talk a little bit about the initial role of the city in the ISM work, what it looks like at the moment, and where we're headed to is a bit of what we're talking about today. And of course, when we talk about the city, we are talking about a series of divisions that work on this. So it's not one division at the city alone. It's not one section within a division alone. It's a number of different areas of work, including the Tenants First team, all of senior services and long-term care, my own office, and the work that I do as the deputy city manager as well. So we use the term the city, and that's meant to include a number of people, and I think a growing number of people as we move forward, because the work we're doing here is not just about a discrete amount of services, and it's not just about looking at 83 buildings alone and the tenants that live in there. That's our primary focus for sure. But this is also an approach that's necessary for cities to take. If cities do not figure out a way to better provide the right level of service and support to older adults living in housing, whether those are city-run housing facilities or whether they are housing within the general community, we're going to struggle moving forward. And so it is deeply important that we get this right, given the fact that this is a corporation of the City of Toronto, but also this has broader implications for the entire community. So you know what the integrated service model supports. It's the 83 buildings and the 14,000 plus senior tenants that are in those buildings. But I want to pause here and just make sure that we understand that when we are talking about an integrated service model, we're not talking about a clinical model. And sometimes our titles and our language and even our acronyms tend to skew us in a direction or not. This is really about looking at those services and supports and also the activity of the staff on a daily basis that will make the Seniors Housing Corporation work that goes on and the enjoyment of the units by those tenants to be at the very highest level it can be. And so this is not about healthcare services alone. This is not about a clinical model of it. In fact, some have along the way and in private conversations with me said, you know, are you moving down the path that these buildings would look like nursing homes? And the answer, of course, to that is no. What will be present always is the desire to look at individual tenant needs and groups of tenants' needs and ensure that we're wrapping those right kinds of services around. So I pause there just to clarify that, because I think it's really important that we understand that when we talk about service, it is the service of the day-to-day operations that will be undertaken by the Seniors Housing Corporation. It is services in the community that could be based in terms of recreational activities. It could be library services. It could be other social supports. It could be health services. And it can be the services and the peer supports that are delivered by tenants themselves. All of that is what makes up a successful ISM. And so we do have a few objectives. The first is relationships of trust. And it starts with that because in public service, trust and confidence is everything. And where you hear frustration, it's usually about a breakdown in that trust and confidence. And when you hear celebration, it's usually because we have maintained or enhanced the level of trust and confidence that the people we serve have in us as staff members, as board members, as volunteers, as peers, as neighbors. And so we start with that. And so the engagement work that we're trying to define, the support that we're providing for STAC and its future as an entity that provides advice and guidance along the way is critically important. The second piece is better housing services. At its core, we need to focus on the day-to-day experience of people within these 83 buildings. And you've heard a little bit about it today. Pest control and the ability to be as pest-free as possible within these buildings is critically important. We've heard about security today in a commentary about the hubs, where people were concerned about community members walking through the building, and how do we ensure the safety and security within these 83 buildings. It is the maintenance and the ongoing ability to have a place that is good to live in, that is good housing, that meets the needs of those who live there. And then finally, it's about the access to health and community services. And I've stressed this on the earlier slide, that is a broad range of things. It also does not mean that we will expect everyone to partake in all of those services. We know that the range of experiences and day-to-day activities and day-to-day needs of those who call the Toronto Seniors Housing Corporation and the buildings that they reside in home, that their needs are varied. And so this is about providing suites of services, providing access, right services at the right time to those who need it. There is a long history of this being part of the work of Tenants First and the work of what we're celebrating over these last couple of weeks, and looking forward to as we build and work together with the Toronto Seniors Housing Corporation. Tenants First was a broad-ranging approach to looking at the work of the Toronto Community Housing Corporation and finding ways that there could be a stronger approach to dealing with certain populations, in this case, the seniors population, allowing Toronto Community Housing to focus more on what's called their family portfolio. It was an opportunity for us to continue to develop and look at models of service delivery that would ensure that there is an integrated support, among other things. So part of this exercise is what brings us to this organization that we've all been working on so hard over the last year or so. But part of it is also the service delivery that we'll be looking at as well. Here's a little chronology on the direction and a bit of the history of ISM. And the reason that the city is involved in this is that there are a number of services that the city deliver, and there is an amount of expertise within the city of Toronto that can really help support the successful implementation and the successful ongoing monitoring and evaluation of this type of service delivery model. At the end of the day, the City of Toronto is the shareholder of the two corporations, and the work of both the Community Housing Corporation as well as the Seniors Housing Corporation is of utmost concern to our council, to our staff, and ensuring that the services that are provided are the right services, and ensuring that they're delivered in a way that is meeting the type of quality that tenants demand, and that we would demand as those who understand how these services should be delivered is paramount to us as well. And so you also see that one of the reasons that I'm here today and sharing some information with you is that it was decided that because there are multiple groups and sections within divisions working on this, that the Deputy City Manager for Community and Social Services would oversee the work of ISM. And so, as I've described in a variety of ways and is shown here visually for you, there are many partners in the work of ISM. And the box in the bottom right-hand corner, it's sort of a nice olive green, talks about some of the role the city has. And one of those roles is around the transition that we've been seeing happen with the development and now the startup of the Seniors Housing Corporation. We are playing a role in supporting STAC, and that will continue, although we need to, of course, work with Tom and his team to ensure that there's a strong connection of STAC with the Seniors Housing Corporation. This is not about setting up a telephone line where information has to be to the city first and then somehow shared with the Seniors Housing Corporation. This will be about collaboration. But the city has been asked to provide leadership and support to STAC, and that will continue. We have a housing secretariat, which of course is very deeply involved in the work of the Seniors Housing Corporation as the service system manager. So there is a regulatory and legislative role that the City of Toronto plays within this organization. And that very much has to do with the fact that the Seniors Housing Corporation is a social housing provider for the most part. Our Senior Services and Long-Term Care division oversees and evaluates the work of ISM, but they are drawing in expertise from all sorts of areas in order to help that happen. So we've placed it in an area that the city also decided would start to integrate thinking on senior services. So not only does Jennifer deliver on our long-term care goals as the City of Toronto and does that extremely well, she's also thinking more broadly than just those who call our long-term care facilities home. It is about a hub of expertise and understanding of the issues of aging in our community and the needs of seniors within this community as well. So to date, here's a list of some of the roles that we've played within ISM, developing that framework and talking a bit about accountability. We have been overseeing and evaluating some of the work to date. We need to do a better job of understanding how we're going to, in the future, develop a much more robust accountability and evaluation framework that we can see that is clear and transparent about how we're doing on those three buckets of work that I talked about earlier: the trust and confidence, the day-to-day housing services, and then the access to those health and community supports. We have been working around partnerships with health providers as well as other service providers, the supporting of STAC, as I mentioned before, and you've heard about some of the work that we've undertaken at the direction of either organizations or council to look at other issues that are facing some of our senior tenants. We've also been heavily involved as the city in supporting the transition that has occurred at the Seniors Housing Corporation, and we'll continue to support that organization in whatever way we need to ensure its success. So as we look ahead, there are some things that are not going to change and may not change in the longer term either, but certainly we're going to be involved and continue to be involved in supporting STAC. I have personally been the chair of these committees as we work through a bit of a transition, and I have found them to be extremely valuable places of conversation and not just feedback, but actual real hard truths about what needs to change in order for us to be more successful as we move forward in the future. We will be involved in engagement and the support to all of the evaluation of the ISM work that continues. And you've heard a little bit about the Seniors Health and Wellness Initiative review, and clearly we have some work to do to bring some context and some history so that we can not only understand where people want to go, but understand what worked or didn't work in the past. And this final bullet point in the setting the Seniors Housing Corporation up for success is really important. ISM is about work that happens on the ground that is critical to the well-being of tenants on a day-by-day basis. not just coordinating services, not just thinking about what the future of community space might be and how that is shared amongst the tenants and their individual needs to utilize that space, their collective programming that they may wish to do as tenants. It's more than that. It's also about how we're making sure that we can clearly understand where we're making progress in terms of these 83 buildings and their general operation and the supports that are provided, and where we need to do better work. And so we'll be sitting down with Tom to understand how we'll be able to clearly review on a regular basis how the operations of not only the service integration work, but all of those pieces are going at the Seniors Housing Corporation. And that tips us into the long-term piece and all of the ways that we will bring information through the tenants and through the work that we're doing collectively to the Seniors Housing Corporation, through this committee, and directly to the board to help improve not only ISM, but all the other elements that we may want to be looking at in terms of what tenants need. And then, of course, there will be at the appropriate time what the future role and responsibility of STAC is, and that conversation needs to take place as well. So I leave this committee and through this committee to the board with the sense that the city has a profound interest in the implementation and the ongoing quality improvement. And it's not to say that there aren't things working well now, but I come from a belief that you can get better every day. Perhaps it's the fact that I've refereed basketball for 33 years and I've never refereed a perfect game. So I get better every game, and I've done thousands of them. And I come to work with the same feeling. So I think sometimes the sense is by saying we've got to get better that it's completely broken. I don't believe that. But there is significant work that needs to take place to say, what does continuous improvement and continuous quality improvement look like for not only ISM, but the other elements of this transition to the Seniors Housing Corporation. The City of Toronto will continue to be there as a partner in this work. In certain instances, we'll be responsible for setting that framework and accountability for how that evaluation and ongoing work will be viewed. But it won't be done in isolation. It'll be done in concert with Tom and his team to understand what are those types of measures that we can continue to review and work together on. But I also think it involves the tenants themselves helping us to set an agenda for what accountability looks like. What are the things that tenants also want to see reported upon that will give them the confidence that that there is a process for improvement, a process always to get better as we go on this journey together. So I think I'll leave it there. We close by understanding that this is an exciting and diverse portfolio of work that's before us, and that the city is proud to be a partner with all of you on this work. And we look forward to working with Tom and his team as we go forward. And we all have the same goal in mind, but it's now time for us to put some very strong operational parameters around how we will understand that this work is actually going in the direction that we all want it to. So with that, I'll stop sharing my screen. Thank you for the time this afternoon, and happy to entertain any questions. I know I've been instructed to bring back some work, which we will do. So no need to reiterate that. I was on the call at that time, and I'll take that away, and we'll bring back some information in terms of the historical nature of some of the work around the hub. And I look forward to any of your feedback or commentary.
Thanks, Paul. And I know we don't have a ton of time, and maybe this doesn't require a response, but just actually taking it away, because it was a comment that was made earlier in the deputation that the current structure could actually appear very siloed to our tenants in terms of who's in charge of what. And I think as we do the work going forward, and how critical this ISM framework is, that we need to actually be bringing this forward so that people actually see how it's landing into the new corporation, and find some ways to actually make sure that it's actually not setting up further silos. It was a comment that was made by Maureen earlier on in the deputation. Any quick comments for Paul? Because I think that yes, Paula, Councillor Fletcher?
Yeah, thank you. I just want to go to the page 4 of the report, the ISM objectives. Thank you for this. I like these little charts, relationships of trust. And I think they're actually in order. I think the trust piece is really the first and foremost, and we keep hearing that. So show us that you're different. Show us you're going to be doing something different. Show us that you're not all talk, that you're action. So I think the relationships of trust are here, our board and our committee, we need to hold that very close, that's our role to ensure that's happening. Again, I've asked for that overview of the building in looking at the ISM. So we're looking at building, and I've been clear, it's not just, and thank you, Paul, for saying that, it's not just a medical model, it's a whole piece, including safety. And Brenda, you bring that up. You're older and frail. You're worried about who might be at your window or who's at your door and how that's being dealt with. But I really am bringing this up again. I think it's my third time around out of the gate, and it has to do with the incredibly large number of cases of bed bugs in these 83 buildings compared to the other 90 buildings. And the ratio for seniors is unbelievable. And I think that we have to show, I'm saying this to you, Linda, and to the board, and to you, Tom, we've got to show, put our money where our mouth is, find out where these are, what's going on, what's happening, because every business that you get paid 3 times to go in and spray 3 times. And the more times you can spray, the more money you make. So everybody knows that that's one of the issues for bed bugs. But what's going on? If we're talking about ISM, that means healthcare, it means public health, it means our staff, it means understanding what's happening. And if we can do one thing, easy peasy, before we finish all these reports, is to start tackling that. But knowing what's what is number one. So I'm laying that gauntlet down because I'm going to be relentless. And that chart that we had that I sent to you, Linda, it's public chart. This is not a secret, it's in public. Yes. But the only people that have to care about this now is this group here.
So can we put this as an action item, because it wasn't an agenda item, that we actually have a report back on the pest control? It could actually be something that comes between meetings. I agree with you, Paula. Councillor Fletcher.
Yes, I don't want to hear a great report on here. So I want to see, here's the buildings, here's what's happening. Here's people that are sprayed more than 10 times, because I personally have dealt with somebody out of my ward. I'm sorry, sometimes people don't like councillors in their in their committees or whatever, but I have very direct experience. A woman 10 times, her son phoning me. That was a while ago. I think it's still happening. So this is information we have. Let's have a plan, Linda. Thank you very much. And I'd like that chart tabled for every member of this board, because except for the mistakes in the math, which of course I woke up in the middle of the night and realized I'd done the
Thank you. I believe
take that part off. Leave that up for Lawrence. Lawrence, that's up to you to do the math. Thank you very much.
Councillor Fletcher, and we will make sure that, Tom, if you can have a follow-up on that, that would be terrific. I realize we're actually nearly at the end of our meeting. I want to actually ask for an approval for information of that excellent presentation that the Paul Johnson just presented. Can I get a for information?
Go ahead. So moved. Yeah.
And seconder. Yep. Got to go through the procedures. Thank you, Carrie. All in favor. Thank you. And our final item is actually a quick update from Tom Hunter. And actually, before people drop off, I wanted to wait until everyone was on the line to just actually personally, as the chair, say a thank you to our team who actually did a wonderful job in launching. I want to thank Councillor Fletcher, who was an extraordinary MC and really, brought such a wonderful, lovely approach to the Tuesday launch. All of the members who came, the city members who came, and a big shout out to Arlene and her team, who, it made it look effortless, and it's not. But just a real thank you on behalf of this committee for all of that work. Over to you, Tom, for your priority setting.
Linda, can I just add one thing before, just a quick thing? I hear your point about the relationships of trust, Councillor Fletcher and Paul. And I think that's very important. And just a red flag that maybe we need to, it's hard. This is a skill set and that doesn't come easy. And I'm wondering if we need to red flag either with HR or training that there may be need for some staff development, even board development work on how do you develop trust? How do you work with people? How do you regain, how do you rebuild trust? Because we all talk about this and it's one of the hardest things to do. And it's not like you can hire for it or there's a specific skill you can point to. So I just want to point that out because Arlene and her team and other people have been doing great work. And I want to make sure we carry that momentum going forward and but also recognizing how challenging this can sometimes be.
Yeah, thanks for raising that, Brenda. I think you're absolutely right. So let's think about that. And actually, this probably segues quite nicely into what you're thinking about, Tom. So maybe over to you, Tom, for the last item.
Great. Yeah. Thanks so much, Linda. And this was I will not be long because it was a conversation that I had with Linda, Arlene, in terms of preparation for this meeting, just talking about, that the aspect of quality tenant engagement and about, how do we, for one, the measure and ensure that there's accountability kind of service standards as we start to look at our work with, seniors and looking at information over the last weeks, I was seeing what is the ISM, the accountability framework, the quality improvement indicators that are presented to the board, and then the 100-day priority report, there's indicators. And I think it's just really important that I'm hearing it today that as we work forward, I think we need to prioritize what are those indicators that best reflect. I think when Paul was saying, I'm just looking at them now, trust and confidence, the day-to-day operations, and the services, the access to services that our tenants can achieve. And so what are those? In my work in long-term care, we put up, a balanced scorecard of our performance. It's a term for, what were the 20 targets that we were going to try to hit? And that was in the home for the tenants and the families and the staff to see. So I think it's about identifying those priorities, committing to those, and then working with individuals to achieve them. And if members of the committee or board want any further detail on the indicators that we can collect, that we can provide, but let's really start to identify where we want to focus around kind of quality improvement, measurements of improvement to ensure and illustrate our success in this work. So that was the start of just kind of setting the stage for what we want to achieve on that front.
And we will have more details to come when we aren't 13 days into the corporation. And I want to thank everyone. I think actually this was a good meeting. It isn't easy work, and I think that it's really important. I do pick up that we are actually all on the same page in terms of where we're heading. We may not have all of the information, and it may not be all perfectly laid out right now, but I think actually we're on the right path. To actually tenant participation, tenant engagement, and really looking at enhancing the homes that people live in. So thank you all for your contributions. I think our next meeting dates, Arlene, are.
We actually, Linda, that was one of the things we were going to discuss it, but as we're at time, we will come back with some proposition for next meeting dates. The board is breaking over the summer, so I'm going to presume, maybe incorrectly, that the committee will probably not be meeting until the fall again, or how do you see that working, Linda? That was one of the conversations.
Yeah, probably depends on the work. Like, so there's like, I think maybe we take it away to figure out, I want to make sure that actually some of the work that we commissioned today, it can come back to us. So I'm thinking that we might want to have a meeting over the summer to actually keep the momentum going. I see Carrie nodding and
yeah.
that, but we probably need to check in on calendars.
Okay, so we'll work to coordinate calendars for meetings over the summer. That was one of the points that we just wanted to land today as to how you'd like to move forward. So thank you for the confirmation.
Can I just ask one thing, Raj, Arlene? I called you Rajni at the meeting, and I'm sorry because I hadn't met everybody in person. I think there was the 4 launches already. Have they all taken place? I think it'd be great to just circulate some of the photos because I think they were all really great. I've heard from others so that they were good. So if you don't mind, just giving us that feel of just the excitement of everybody there, all the staff was there, all the city was there, the tenants were there, and it was just terrific. So I do want to thank you again for such a great one at Greenwood. And I'd love to see all the photos from all four. Really, really exciting.
Yes, thank you, Councillor Fletcher. And we will deliver that. We're actually putting together a piece that's going to be circulated later this week.
Fantastic.
And we will make our photos available. We had a photo disclosure, so our consent, so we'll be able to make our photos available also to our labor partners. We've invited them to perhaps take some of our photos for their communications as well. So there will be information on our website. There will be information that we will share with the board, and there will be information we'll share with the employees and the tenants as well. So for sure, we'll do that follow-up.
Thank you. Thanks so much, Arlene.
Yeah,
I just apologize before sorry, Councillor Fletcher, sorry. If I may, Madam Chair, can I just make one quick announcement?
Yeah, sure.
Just before we head off, I wanted to introduce Wendy Dobson, who's going to be taking over the committee for the future meetings, because I will be stepping down. So I just wanted to make sure everyone knew that Wendy would be coming into future meetings moving forward.
Thank you very much.
Arlene.
I know.
So
we're gaining
Wendy.
We're gaining Wendy.
Let's just have a motion of thanks, please, Chair, for Arlene and all the tremendous work over the whole year. Formally in the
Thank you,
minutes,
Arlene.
please. Thank you.
For your sensitive work.
Thank you very much.
Great job.
Having all of us. So that's fantastic. And Brenda, is that a new hand?
Yes, just a quickie on the 100-day priorities. Has that been ranked yet? I mean, I know that the tenants came up with some ideas. Have they been ranked, or has it just been free, open discussion about what the priorities should be?
So when we brought forward that document at the April meeting, it was we proposed what was doable within the time frame of the 100 days. I believe that most of it will be ongoing. It's not going to be concluded in 100 days. And to the conversations we've been having here, one of the priorities that was raised was bed bugs, and it was not something that we could tackle in 100 days. But we will have to address what does it look like right now, and then how are we going to move forward in dealing with it. But our goal is to be able to begin reporting on that in July, those 100-day priorities, the ones that we're able to report on. Yeah.
All right, and the last one was the bed bug, the listing of bed bugs. Was that only seniors buildings on that list?
No.
No, okay.
It was comparative.
Yeah, but I think we do need to actually make sure that that is actually prioritized, and actually that we have the data and the approach. So thank you.
Thank you.
Thank you all. I'm going to ask for a call to adjourn.
So moved.
Thank you, Carrie. Seconded by Jim. All in favor. Thank you all for. There was a lot of work that went into this meeting, and I just want to thank everyone for all the work that you did in preparation and for actually working through the issues with us. And we will keep working at it. Thank you.
Thank you, Chair. Thank you very much, Chair. Great job, Linda.
Thanks, everyone.
Thanks.
Thanks for the invite.
Thank you. Bye.
Bye-bye. Thanks, staff.